WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. And we have called every day for countries to take urgent and aggressive action. We have rung the alarm bell loud and clear. The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries.
This is SARS-CoV-2. It belongs to the family of coronaviruses named for the crown-like spikes on their surfaces. SARS-CoV-2 can cause COVID-19, a contagious viral infection that attacks primarily your throat and lungs. What actually happens in your body when you contract the coronavirus? What exactly causes your body to develop pneumonia? And how would a vaccine work? The coronavirus must infect living cells in order to reproduce. Let's have a closer look. Both a typical influenza virus and the new coronavirus use that houses all its genetic material. The coronavirus, on the other hand, doesn't need to enter the host cell nucleus. It can directly access parts of the host cell called ribosomes. Ribosomes use genetic information. Now, with the virus spreading in your body, how can you develop pneumonia symptoms? For this, your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. Pneumonia may cause difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. It can also lead to more serious complications. Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. These are the machines that save lives and that medical device companies currently ramp up production for. Whether you would develop these symptoms depends on a lot of factors, such as your age and whether you already have an existing condition. While this all sounds scary,
Indonesia also has the most number of coronavirus deaths in the region, second only to China. More than 1,000 people have died so far from the disease, according to official figures.
Ratusan kolega kita, para tenaga medis, terpapar COVID. Sebagian meninggal. Ribuan dimakamkan dengan prosedur COVID. Ribuan keluarga di Jakarta ini kehilangan kerabatnya dan mereka tidak bisa mengantarkan ke pemakaman orang-orang tercinta.
Percuma juga PSBB, coba ribuan orang di sini berkumpul. Hah? Percuma, bohong. Gak punya inovasi. Hah? Gak ada PSBB. Ngomong kosong semua itu, bubarin PSBB.
If you are a genius living in Indonesia or Iceland or Zimbabwe, COVID-19 will be here for at least 2 years. I was wrong. COVID-19 will be here for 100 years and it will change our lives forever. But how exactly? Well, we'll be around for a long time.
And I think this is what we all fear, is a vicious cycle of public health disaster followed by economic disaster, followed by public health disaster, followed by economic disaster. There is some magical thinking going on that lockdowns work perfectly and that unlocking lockdowns will go great. Both are fraught with dangers. This virus may become just another endemic virus in our communities, and this virus may never go away. Not gone away, but we've come to terms with the virus, and we have found the therapies, and we've found the prevention methods, and people don't feel as scared as they did before, and we're offering life.
Lihatlah rakyat Jakarta, lihat rakyat Indonesia, lihat rakyat di berbagai belahan dunia.
At the moment, we obviously consider the risks to still be high at all national, all regional, and at global level. But there is no formal system of de-escalating this other than for WHO to change its national, global, and regional risk assessments.
There is no one solution to bringing these outbreaks under control. It's a comprehensive package that needs to be implemented, which starts with finding cases, caring for cases, making sure that they are isolated so that they don't have the ability to pass to another person. It includes comprehensive contact tracing to ensure that any of the contacts are kept away from others, so if they were infected, if they develop disease, if they are infected, they can't pass it to someone else. It includes all of the public health measures, hand hygiene, respiratory etiquette, mask wearing, informing the public, engaging the public. It includes stay-at-home measures when they're put in place. But hopefully, when countries need to implement stay-at-home measures or other types of measures, they're done for a short amount of time, as short as possible, in the smallest geographic area as possible, so that we can keep economies going. What we're going to have to figure out, and I think what we're all going to have to figure out together, is what our new normal looks like. Our new normal includes physical distancing from others. Our new normal includes wearing masks where appropriate. Our new normal includes us knowing where this virus is each and every day, where we live, where we work, where we want to travel. And that's going to be part of how we move forward with this. Finding the balance between keeping the virus transmission low and resuming normal activities.
Seluruh anggota grup ini untuk sering-seringlah komen supaya teman-teman kalian tahu bahwa kalian masih hidup.
There are predictions tonight. One of our closest neighbours, Indonesia, is on the cusp of a full-blown coronavirus disaster. The country has the world's highest death rate, but is testing the least amount of people, and it's feared half the nation will soon be infected.
Fewer than 3,000 people out of 267 million have been screened, equivalent to just 160 people in Australia, and resulting in a whopping death rate of more than 9%. While that rate is expected to drop as testing increases, modelling suggests infections will skyrocket from just 790 confirmed people to half the population, with no stringent lockdowns in place and a health system unlikely to cope, medicos wearing raincoats.
According to the Health Ministry, Indonesia has just over 8,000 ventilators nationwide for a population of 270 million people. It also has 2.7 critical care beds for every 100,000 patients.
You can take a level of precaution, you can have a little bit more confidence in your interactions, but we need to define a new normal where we take more precautions in our daily lives that we just didn't do before. Wear a mask, probably. We're probably going to be wearing masks for a period of time. I think they're going to become something that's more socially acceptable. cleaning your hands, being careful if you go out socially, watching your circle of friends as well. People are starting to define their circles a little bit more narrowly, people they trust. I think we're going to have to start thinking about all these things a little differently until we get to a setting where we know the infection really isn't spreading in our communities that we're staying within, and then we can be a little bit more relaxed.